Good afternoon. Good afternoon. This is Dr. Velma Scanterbury, medical consultant for Dialysis Patient Citizens Educational Center. And we are here today on Wednesday, June the 4th, to answer your questions. This is Patient Citizens Instagram page if you're here. And we also want you to invite your friends, and we will be here live for the next 30 minutes. So again, thank you for those who have joined in the past, and hopefully we will have a decent audience today. Like I said, I'm Dr. Velma Scanterbury, and I am the medical consultant for Dialysis Patient Citizens Educational Center. So thank you, Nancy and Hannah, and is that Mel? Don't see the name. Thank you for joining, and please post your questions. If you have friends or family who are on dialysis or have had a kidney transplant or are transitioning to being on dialysis with end-stage renal disease, not yet on dialysis, and need information about choice of option for kidney replacement therapy, or even if you are a caretaker and want to know more about how to take care of your loved ones who may be on dialysis or even had a transplant, or transplant may not be doing well, and what are your options? What should you do? As we know, we are in the middle of the summer. We've got all these changes coming down the pipeline. As far as vaccination, you need to get those vaccines prior to getting on the transplant list so that you have those antibodies that are necessary to protect you after the transplant. Because one of the things that happen is when you are on anti-rejection medicine, it dampens your immune system so that you're not able to make antibodies at the same rate as you would before your transplant. Even though with end-stage renal disease, you are still considered immunocompromised, and so your antibody load may not be as great. So we want you to go ahead and get all your vaccinations prior to getting on the transplant list, so your antibody levels are as high as they would want them to be, because afterwards, at least for some time after you've been transplanted, your immune system is so compromised that you really cannot get any vaccines in the first 3 months or 4 months, depending on what level of immunosuppression you're receiving, because you will not form antibodies. Your anti-rejection medicine will keep your body from developing those antibodies, because that's the role of anti-rejection medicine. We don't want you to develop antibodies because we don't want you to reject your transplanted kidney. So those are things in terms of understanding how to keep yourself well, even if you are on the waiting list and have been waiting a while, and know the importance of maintaining fitness. Oftentimes we have to keep sending patients who deteriorate in the functional level, and the ability of what they can do is worse from year to year. You want you to maintain that exercise ability. Sometimes it may require, you can ask your doctor for prescription or a referral for physical therapy for strengthening and endurance as you get older, so that you can maintain your stamina and endurance, because that becomes very, very important afterwards. As we age, one of the things that's important is not to get transplanted and then not have enough strength to recover after the transplant, or having to end up in a nursing home. And so it's very important to maintain your muscle strength, continue to walk. If you can walk, continue to exercise, and maintain that ability to stay in good shape, because it's your muscles it's your overall functionability that's going to help you recover, do well. If you have any complications, you want to be able to handle those complications, and get out of bed and ambulate, because that is the main thing after the transplant. We just like any other operation, it's about getting up, walking, preventing pneumonia, preventing infections, and to get home and tolerate your medication. So thank you very much for all you have joined. Again, this is Dr. Velma Scanterbury. I am the medical consultant for Dialysis Patient Citizens Educational Center. So if you have any questions, please post them in the chat. Welcome, Megan and Yolanda. Appreciate you who have joined so far. And so I'm just here talking about really improving your status prior to getting on the transplant list. If you're on dialysis, you want to be able to make sure that you maintain the functionability of your heart. If you have seen a cardiologist and you're still on the waiting list, remember you still need to see that cardiologist or get cleared on a regular basis, at least annually, because when you come up for a transplant, they will want to make sure that you've had your most recent stress test and you've had your most recent echocardiogram. If you have had coronary artery bypass, it's even more important to make sure that those things are on par so that you don't get skipped when it's your time. So cardiac status is important. Cancer screening is important. Make sure you get your mammogram, and you want to make sure that you get your colonoscopy, prostate check. All those kind of things have to be up to date by the time you get called for your transplant. For the clarification, adult transplant with pediatric kidney. Yeah, pediatric kidneys can be used in adults who are on the lower side of size. We try not to put a small kidney into a very large person. So we would often try to use a petite person where there's not a whole lot of strain for that kidney to work very hard. And if the child is under 3, generally we may use, or sometimes under 2, depending on the size of those kidneys. We will use both kidneys together. We will call them lollipop kidneys because they may be about this big. And we'll use both of those together to transplant into a smaller adult, knowing that these kidneys will have to take on the challenge of going from a 20 kilo child to now a 60 kilo person or 70 kilo person. Those kidneys together will slowly make clear creatinine at a much slower rate. So the creatinine, instead of coming down 1 or 2 points per day, may only decrease at 0.3 or 0.5 because the kidneys are small. So it will take a longer time for that creatinine to get to baseline. But as long as those kidneys are making at least 1,200 cc's of urine a day, that creatinine will improve once they start clearing. They will increase in size over time because the demand of that body is much more than the original location where they were donated from. And so those kidneys will actually continue to grow until both of them together are the size of an adult-sized kidney. So yes, those kidneys will continue to grow. Thank you so much for that question. Any statistics on kidney rejection after having COVID? The issue depends on, the issue is when you get COVID, if you're immunosuppressed or you have a transplant, you want to be able to get treated. We want to be able to give you the medication so that you can fight off that virus and not have to have your immunosuppression lowered, because whenever you get an infection, your immune system, in order to get your body to make antibodies to take care of that infection, for some patients, we may have to cut back on your immunosuppression depending on how ill you are. If you're severely ill, we will back off on your medication, give you the antiviral therapy, and hope that you will be able to overcome the virus. The goal is to be able to make sure that your immunosuppression is then put back to a normal level once you recover, to prevent rejection. So it's about if you have the virus and you're not severely ill, get into treatment for COVID without having to alter your immunosuppression. But any situation that causes your creatinine, that causes the development of antibodies, can often spark rejection. So we often say if you have an infection and you got treated, you want to make sure you check your lab work afterwards. You may have a spike in your creatinine, but you want to make sure it comes back to normal. So that becomes important. There have been talk of new viruses if transplant patients be masking up. There are reports of a new strain of COVID that is in several states, mostly found with travelers on the outer ends, east and west coast, New York, Boston, California, and some other states from outside travelers. It seems to be, they have been, well, certainly it because of the international travelers, you want to be careful if you are traveling across the country or going on vacation to, now that it's summertime and you're immunosuppressed, I would recommend, it may be better to mask up because you don't know who you're going to be around if you're taking the train, certainly if you're flying and you are considered immunosuppressed. Not only mask up, but remember to use your hand sanitizers because, you want to have that mask on, but you also want to keep your hands clean from opening doors and bathrooms and the whole 9 yards. We tend to do it without thinking about it, but you want to be able to have that hand sanitizer, especially, cleaning down, if you're traveling on a train, a bus, a plane, cleaning down those handles, making sure you wipe all around you because you're not sure who was there before, who was coughing, who might have been ill. And also, there's also a higher incidence of measles going around, so if making sure that but mostly it's with travelers who are unvaccinated, those who have left the United States, go abroad, not vaccinated and can come back and may not be symptomatic enough to know they have measles, but you may be, and hopefully you're vaccinated and therefore immune from that. Long-term effects of COVID on renal patients having COVID. Well, we know that, you think about COVID is a virus, and viruses you can treat, but oftentimes viruses do not go away. They live dormant in your body, and the goal is to be able to neutralize these viruses. And so we know that COVID affects many different organs. If you think about the fact that when you develop loss of taste and smell, those are from your cranial nerves that come down into your face. So those are cranial nerves. So you think about the fact that that COVID is in my brain, affecting those nerves that come off your brain. People get pneumonia, so it's in your lungs. People get blood clots. So that's an issue in terms of your vascular attacking your vascular system. Liver numbers can go up, kidney numbers can go up. So oftentimes, certainly once you have COVID, long-term effects is some patients end up with worsening kidney disease, especially if you've had a transplant. Your creatinine may be much more elevated after having COVID. And so you want to be able, if you're on dialysis, certainly that may not necessarily be an issue you worry about, but you might have prolonged respiratory illness. If you have asthma, you may have a prolonged issue with COVID if it affected your respiratory system. And so many patients, as any renal patients, is pretty much in the same category as others. You may have long-term mental fog, remembering things. And so there is that COVID fog, that COVID fatigue. We've seen many patients who've had COVID and developed some autoimmune diseases. Now they have joint pains and muscle pains that they didn't have before. It's hard to substantiate that there's a clear relationship, but they certainly have some commonalities that it shows that it's associated or linked to probably having that COVID infection. So there are many long-term consequences. So talk to your doctor, make sure that you're not having drawn-out symptoms from COVID. And so one of the things I wanted to touch on, Nancy asked about overload and never missing dialysis. I just unfortunately do have some patients who don't feel well, and because they don't feel well, do not go to dialysis. Well, part of not feeling well may be that you now have fluid overload and you have too much volume on board. And it becomes important, especially if you have no source of getting rid of fluid, if you're not making urine or not making any substantial amount. A cup of urine is not going to keep your fluid balance in check. You need to be making at least 500 to a liter to be able to say that you can take in extra fluid. So if you have a long weekend or you even had an occasion to celebrate and now you're over your standard amount of fluid restriction, that fluid has no way to go. And when you miss dialysis, you miss the opportunity to take off that extra fluid. And what does that do to your system? One, now you've got, just imagine if your gain is 3 kilos, which is about 7 pounds. If you've gained 8 kilos of extra weight, and you're thinking 8, but multiply that by 2.2. 8 and 8 is 16, plus maybe 2 more. So now you have 18 pounds of extra fluid. Just imagine what that feels like, almost 2 10-pound bags of sugar and our flour, and now your heart has to handle that. So what that's going to do, that's going to be a drain on your heart. And so one of the common things you will see is that now your heart disease will be worsened by this yo-yo effect of fluid on, fluid off. So now if you blow a balloon up and now you leave it with extra air and now you want it to go back to normal, it's going to have a hard time getting back to its normal state. It's going to stay dilated. It's going to stay, it will be stretched out, and the pumpability of that balloon to work as well as it did in its original state is now lost. And so think about your heart about that. Your heart now has been stretched. You lose the ability of your heart to pump well. So having fluid overload, extra volumes lead to cardiac disease, worsening heart function, and can get to the point where you're no longer a candidate if your ejection fraction drops below 30 or 25%. Likely you're no longer going to be a candidate. It means your heart is unable to pump 20% out. That's all it's getting out every time it pumps. So take care of yourself. Do not overload your fluid and do not miss dialysis, because that is your key to getting that fluid off, and that is the key to maintaining your heart and your heart longevity. What's the number one cause of death for patients on dialysis? Heart disease. Protect your heart in whatever manner you have to. So you have to go thirsty, you have to burn it off, exercise, but most of all, minimize your fluid intake. Hair loss and dialysis and or transplant, myth or fact. I know certainly, stress can cause you to lose your hair, depression, a whole lot of things can go into why you have hair loss. Medications, I know particularly with transplant medicines, we will see patients will have hair loss initially when the dose of your anti-rejection medicine are at the highest level in the first few months or the first 6 months. And as those medicines, as you go away and have less likelihood of rejection, you will have those levels, your dose will be decreased. And over time, we will see patients who had initial hair loss will have some of that hair come back. Some people may not regain the same type of hair, but I do know for sure that you do have, and not everyone will have hair loss, but some people will have hair thinning, and a lot of it is attributed to the transplant medication. It can also be related to your body being overwhelmed, the whole stress of the transplant process, all those things in terms of what's going on at the time. So it's important to discuss it with your doctor, and oftentimes it's maybe an exchange for getting a kidney and getting off of dialysis. Now you have thinner hair. But you can see your dermatologist. There's many recommendations out there as long as you haven't lost your hair follicles, and that there's still the ability of your hair to grow back. then if there's follicles are still there, then it's possible. And another question, after transplant, our steroids decrease? There are different protocols with steroids. There's steroid-free protocol. There's steroid tapered protocol, which you will get steroids only in the first day or two intravenously, and then you go home on no steroids with a double therapy, or those that will have triple therapy with steroids, but for a shorter time, maybe 3 months, 6 months, and then it's tapered off. It all depends on your status, your match, and your prior history. If you come in on steroids because you're on lupus, you have a history of lupus or an autoimmune disease, it's unlikely that you will start out on high doses of steroids, but it will be decreased to your preoperative dose to maintain your autoimmune disease condition that you were originally on steroids for. If you have antibodies or a high risk of rejection, or you are a retransplant number 2, 3, or 4, the likelihood that you have pre-existing antibodies from your previous transplant is going to be very high, and your risk of rejection, therefore, is going to be high. So in those cases, it is unlikely that you will come off of steroids within the first year. Generally, they're kept to make sure that you have gone through your rejection, your rejections have been treated, following your levels of donor cells, donor antigens, with a new test that's look at your ability to develop rejection. That test can then predict whether there's likelihood that you will be able to come off steroids without facing a rejection episode. So this all depends again on your situation. Each person is different from person to person, and whether or not only just your kidney donor, but also in terms of whether you developed antibodies even post-transplant. You may not have antibodies pre-transplant that were detectable, but now after transplant, you now have developed antibodies to your kidney. So those situations means you're more at risk for rejection. So those things have to be monitored to decide whether or not it's safe to take off the steroids as opposed to some other medications. So thank you so much for that question. Vacation time, healthy tips. Make sure you pack all your possible medications for more days than you will be going on vacation, because you never know what will happen. You may get delayed, your flight may get canceled, you may have bad weather, and now you find that you're there longer than you planned to be. So plan to take an extra week of your medications just in case, and to be on the safe side. Don't check them in your suitcase. Make sure they're on you at all times in case your luggage gets lost. If you're out and if you're on a fluid restriction, then you want to make sure you're very careful about when you're out traveling. If you're outside, you may find yourself drinking more, so you may want to be able to carry your own container so that you can keep tabs of what your fluid intake is. Or if you can't, you want to be sure to measure what you're drinking. Also include the frozen drinks. They're still liquid because you want to be careful about not getting overloaded. If you have restrictions, I know we're out the weather, your potassium is already high. If you're in dialysis, then you definitely have to worry about overloading on things that you're not allowed to eat. Potatoes and fries and ketchup, all those things are very high in potassium. It's very difficult. Potassium doesn't get dialyzed out. If your potassium is high, it's an urgent crisis. So if you're on dialysis, you definitely want to be careful with not maybe indulging too much in things that will put you in danger of having to go to the emergency room. That's very important. And get your rest. Don't push yourself. Don't get heat exhaustion. For those of you in the sun, if you're sensitive or have a history of skin lesions, make sure you use your sunblock and you protect yourself. Wear a hat. I always think about... Sorry, lost connection there. Sorry about that. So yes, don't forget to wear a hat and also protect your skin from the sun. Even if it's cloudy outside, there's still UV rays that can cause issues, especially if you're on steroids or your skin tends to be thinner and therefore at risk for more complications. So those are my healthy tips. If any of you have anything that you would want to put in the chat, please do. If you're going overseas for any reason, check your country. Make sure that you get all your immunizations that you need, and often be cognizant of the drinking water. Even if if you go to Mexico, please don't drink the water. Oftentimes it will be sure to use bottled water. Be sure to use it when you're brushing your teeth, things like that. And if you can't remember, get a rubber band and put your toothbrush next to on the rubber band around the bottled water, so that you know that a reminder to, when you use your toothbrush, to use the bottled water and not the tap water. So be sure to make sure that if you're on dialysis and you're traveling, that you set up all the things that you need to have for your dialysis when you arrive there, so you can have a stress-free vacation. Those are my tips, and we have a few minutes left. If there are any other questions, let me make sure. Hair loss, I think I covered most of the questions, and let's see. Yeah. Masking up, COVID, pediatric kidneys. And one of the things I want to add is, because when we think about pediatric kidneys, we generally don't give them to pediatric patients because the risk of complications from pediatric kidneys are higher. And so you don't want to have to take a child back, or you don't want to put the kidney and then have it not work, because it's so disappointing. For pediatric patients, I generally say you have that first time should be the time that they come out of there and expect good things. And so that's generally the goal. And the pediatric nephrologist will often be the one saying, nope, can't transplant, can't put that into my child. So we tend to work with the transplant nephrologist to make sure that the kidneys that are taken for pediatric patients are often adult kidneys, because it gives them better function. There are less complications, and generally for most pediatric patients, we will try to match them with a living donor if possible, or with a young donor if it's a deceased kidney that have no significant issues and that we know will work right away, because that's what we want for this young child, to be able to come off dialysis and not have to be dialyzed and have to explain why they need dialysis when they have a kidney transplant. So we tend to be very sensitive, very choosy, and oftentimes will pass up certain kidneys because they're not good enough, or they're just not, the possibility of not working right away is something that is hard to comprehend for the patient. If they're older, 14, 15, then that may be a better option because they can understand what is going on, and you can explain it somewhat better. So thank you all for your questions. Thank you all for being here today. And we'll see you again on Instagram. But we also have our Facebook coming up in 2 weeks. So for those of you who continue to follow DPH website, Dialysis Patient Citizen Educational website, go join and consider being an ambassador. Get on the website so you can gain lots of good, healthy information on that website, and also pass it on to your friends and family. So have a blessed day, enjoy, be well, and take care.